We're on the Health Watch here at 8:44. September is National Suicide Prevention Awareness Month, and this morning we're talking about the warning signs and the resources available for people who need health. And this is something that Dr. Syed Hussain from Trinity Health of New England has been wanting to talk about a lot because we clearly do not talk about it enough. Doctor, good morning. Thank you so much for joining us.
Thank you.
And we were just talking in the break before how it looks like by no means all of them, but a fair amount of suicides are actually somewhat impulsive, but that is not to say there are not some warning signs that people can see coming. They just need to know what they are. What are some of those?
Right. This is an important month. It's important for viewers to understand the gravity of the situation we have in terms of the brewing mental health crisis. Some of the signs that you can look for in your loved ones include, disengagement in terms of, the activities of daily living, things that interested an individual previously. They have lack of interest, sleeping, changes in sleep habits or eating, and just an overall mood can also be a sign. Not everybody will exhibit those signs and symptoms, though. And this mental health crisis we have runs the entire gamut in terms of suicide on one hand, which is extremely tragic, to substance use and the overdose deaths that we've seen skyrocket into 2022. So it runs the entire gamut, Kim.
Yeah, and it even runs throughout professions too. We've had a lot of people in, Trish Buchanan from East Hartford, a good friend, talking about the problems with mental health and the stigmas in the police officer community, the first responders community, that they don't talk about these things enough. But there is more help that's become available. 988. That is the number to remember. What's that all about?
Absolutely. So this is a number that the Human and Health Services launched in mid-July. It's a national helpline called 988 Lifeline, and it's for those individuals that may be exhibiting or feeling, depressed, anxiety, have issues with substance use, or feeling that they want to commit suicide or any kind of thoughts along those lines. I highly encourage folks to call this number. The data released earlier this month by the CDC indicates that there's a 44% jump compared to the same time last year in terms of people who've actually sought help. And 84% of them who called in got connected within a minute to a counselor, which is really important. So just to give viewers some context, some background, suicide is the second leading cause of death in young adults up to the age of 34. We have 130 suicides in the U.S. alone every day. So it just goes on to show you we don't talk about it enough, but the onus is on us in terms of what we can do in healthcare to improve access and bring more awareness to this issue.
Second leading cause of death in that age group, and almost by definition, it is preventable. That's how we have to prevent it. But I'm also curious in looking a little more broadly at the contributing factors to this rise in the mental health crisis. To what degree has the pandemic played a role?
Big role, especially, again, going back to the data released by CDC, 1 in 4 young adults actually sought help during the pandemic. Remember, this is a very vulnerable time period in someone's life. They're coming out of college. There's a vulnerability there. And, we have a pandemic that really closed so many doors. We couldn't really meet folks, and that led to the anxiety, depression, things that we've been uncovering. So leading to this high number of people, which in a way is good, but there are pros and cons to this because it doesn't improve access to those that are most vulnerable, like our communities of color, for instance. So there's more work to be done.
Yeah, I feel like it affects people on a very interpersonal level. Their day-to-day relationships are getting fractured. It would also seem to be affecting people on a more existential sort of level, that they felt like society was in crisis too, and therefore they were as well. That sometimes induces a feeling of hopelessness or ennui too, that hopefully we can start trying to get out of. That being said, COVID does seem like it's here to stay in some form.
It is. We shouldn't get bogged down in the terminology of where we are. This is a virus that's here to stay, Tim. We have really credible, safe, and effective vaccines. The new reformulated booster will do a great job in terms of preventing a fall or a winter surge. So folks should roll up their sleeves, get the shot along with the flu shot. That's the bottom line.
I know the president had said that the pandemic is over during an interview and caught a lot of flack, especially by healthcare representatives out there who are saying, what are you talking about? There are still scores of people dying each day. But the tools we have the tools, and I think that's the most important thing.
Absolutely.
Yeah. All right, Doctor, thank you so much for taking the time
Thank
to
you.
join us as you do every week. Dr. Syed Hussein from Trinity Health of New England. Okay, moving on. Let's talk about the forecast here. Meteorologist Matt Scott getting out and enjoying some fair weather.